morning, Mrs. Jones. My name is Kyrie. I'm going to be your student nurse today. I'm going to do your assessment, but first I'm going to wash my hands. And then how are you feeling today? Are you in any pain? Just a little tired? Okay. So I'm going to start off with taking your blood pressure. Looks good. I'm going to take your temperature. I'm just going to put it underneath your tongue. Looks good. And then I'm going to take your pulse here. And while I'm taking the pulse, I'm going to look at the IV site, make sure there's no redness or swelling there. Looks good. Now I'm going to listen to your breath sounds, your heart, and your bowel sounds. When was the last time you had a bowel movement? This morning? Okay, good. When was the last time you went to the bathroom to pee? This morning also? Okay. So there's one trick that I can tell you. When you're still pregnant, the baby pushes on your bladder, and as you know, you go to the bathroom a lot. So now that baby's not pushing on your bladder, it's not as sensitive. So you want to make sure that you go to the restroom every 2 hours so you don't overfill your bladder. Breath sounds are clear bilaterally and bowel sounds are active. Now I'm going to move on to the other part of my assessment. It's called the Bubble H assessment. So first I'll start off with your breast, if that's okay. I'm going to put a pair of gloves on. And let me know if they feel tender, if I'm pushing on a certain area and that hurts and the other areas are fine, just let me know. You go ahead and lift up your shirt. Breasts are soft, the nipples are not cracked. Now I'm going to move on to the uterus here. I'm going to use a two-hand technique. One hand goes underneath to support the uterus, and then one hand goes at the top. We call that the fundus. So I'm going to go ahead and feel here. The uterus is firm, it is midline, and it is about 2 centimeters under the belly button, so that's good. Now there's also another trick I can teach you. If you massage that top part of your uterus right there, it'll help shrink it back down, and it'll cause it to contract. You might have a little bit of cramps, but that's good. Now I'm going to move down here and check your pad. Looks like it's rubra, moderate in amount. There's no odors or clots. When was the last time you changed your pad? An hour ago? Okay. Well, that's good, but if you notice that you're going through a pad quicker than an hour, make sure you call your doctor and let him know. I'll go ahead and flip you over here. I'm going to check that episiotomy the doctor did. I'll also check your epidural. So I don't see any redness, edema, or ecchymosis. I don't see any discharge, and the edges are approximated. Same goes for the epidural. There's no redness, edema, ecchymosis. The edges are approximated, and there's also no drainage. So I'll go back over here. Now I'm going to move on to your legs down here. And this checks for blood clots. I don't see any redness or swelling. Go ahead and lift your leg up here and support it. Check to see if she's relaxed. And then quick flexion here. Did you have any pain with that? No? Good. Do it to the other leg. Check to see if she's relaxed. Flex up. Looks good. And that also checks for clonus. And her leg or her foot did not bounce back at me, so that's good. Then I'm going to note the patient's emotions. And she was calm, she was cooperative, she was talkative to me and baby. She was enjoyable to be around. I could also teach the patient about signs of hemorrhaging, or changes of discharge. So if you notice that your discharge is going from that yellowish color, yellowish white, back to that red, you want to kind of rest. You want to calm down, take a breather, and rest, because you're doing a little bit too much work. If she had a C-section, I would want to look at the site. I'd use the Rita method. I'd look for redness, edema, ecchymosis, check to see the staples, if the edges are approximated. And I'd already looked at her IV site, but other than that, that is the postpartum assessment.